This is Rural EMS calling for patient report.
This is MTSA Hospital. Go ahead. This is Ambulance 2589er. We are en route to your facility with a direct admit from Timbuktu Hospital. We have a 38-year-old white female's chest x-ray did confirm some cardiac tamponade. Patient is currently having sharp chest pain, which is radiating to her neck and shoulders. Some bruising is also noted on her lower extremities. Patient was restrained driver in a motor vehicle collision at approximately 0200. Speed of the vehicle was 45 miles per hour. The airbag did deploy. Patient is currently alert and oriented times 4, is a pack-a-day smoker, and currently does take some prescription medications for hypertension, asthma, and seasonal allergies. Her chest pain is 8 out of 10. BP 142/74, normal sinus rhythm on the monitor, 92 beats per minute. SpO2 sats 99%, 2 liters nasal cannula. She has a 24-gauge needle in her left pinky toe. ETA is approximately 15 minutes. Any questions or orders? No questions, no orders. We'll see you when you get here. MTSA Hospital out. Copy that. EMS 2589 out.
Miss Smith?
Hello.
How are you?
Good, how are you?
I'm good. My name is Grant. I'm going to be the anesthesia provider today for your pericardial window. First, I just want to verify your name and on your information. So I see Tori Smith, and your birthday is December 12th, 1987. Is that correct?
That's right, but my friends call me Cupcake.
Cupcake. Okay. All right.
Yeah.
Well, Miss
So you
Smith.
call me that.
Oh, well, okay. Well, now, who's this gentleman sitting here in the room with you?
Actually, that's my parole officer.
Okay, all right. Well, sir, I'm going to have to ask you to step out. I need to address some medical questions.
Sure.
Miss Smith. Yeah, I think we'll be okay. If you will, just wait right outside the room.
About a second, okay?
Thank you.
All right, ma'am. Basically, what I just want to check over, with your condition, we're going to put in a pericardial window. Dr. Feelgood is going to be administering this procedure for you, and this is going to drain the blood from that's compressing your heart from your accident that you had today. I just want to check your allergies. I see that Allegra is your, okay, is that your only medication allergy?
Yeah, that's correct.
Okay, and then your medication list that I have here, just want to review this with you. I see that you're taking lisinopril, you're on birth control pills, and then you take albuterol and Convivent. Is that correct?
That's right, but I mean, I don't know when I had them last.
Okay, all right.
But
You know
that's
when the
right.
last time you saw a primary care physician about your blood pressure?
I don't know. Maybe like 2 years ago, maybe.
Okay, all right, that's fine, that's fine. Okay, something else I need to know is, when the last time that you ate. And the reason we need to know this, we need to know how much food is on your stomach right now, and it's really important that you tell us the truth because we don't want you to aspirate. You could possibly get pneumonia, spend a lot of time in the ICU, and possibly die if we're not completely honest with this.
Okay, well, prior to coming here, I went out for wings, and that was probably 8 o'clock last night.
Okay, all right, well, it's 1 a.m. in the morning, so we'll adjust our care plan. All right, now we're just going to kind of do a review of your symptoms and all of your body systems just to kind of get a general overview so we can deliver the best care plan possible.
All I know is my chest hurts. That's
Okay,
all I know.
right.
So am I going to get some medicine?
We'll
Something?
give you some good medicine. Yes,
All right.
we will. We'll diminish the pain as much as we can. We probably won't be able to take all of it away, but during the surgery, we'll make sure you have good pain management and after the surgery also. All right, we'll just start with that. Cardiac-wise, do you have any other history of coronary artery disease? Have you ever had a heart attack, chest pain, any type of cardiac problems?
No.
Okay. All right, you obviously have high blood pressure. Do you know about how high your blood pressure typically runs?
No.
Okay, all right. And how long have you been on lisinopril?
Maybe, I don't know, maybe since I was maybe like 25,
Okay, all right.
something like that.
And how many times a day do you take that?
If I have it, if I fill it, I'm supposed to take it once a day.
Okay. And when was the last time that you were able to take that medicine?
It's been a few months, maybe.
All right. Okay. Do you have any type of irregular heart rhythms? We're told about irregular heartbeat. All right. As far as your neurological status, do you ever have migraines, headaches, vision problems, seizures, anything?
No. The only time I get a headache is if I drink too much.
Okay.
That's
All right.
it.
Okay. Have you ever had any strokes or any type of concussions?
No.
Is this your first motor vehicle accident that you've ever been in?
Yes.
Yes, okay. All right. The next thing we'll talk about is your pulmonary status, your lungs. Do you smoke? Okay. All right. How much do you smoke?
A pack a day.
Okay. All right. How long have you been doing that for?
Since I was 16.
Okay. All right.
Just talk a little bit louder.
Louder. Okay. All right, and do you have asthma or any type of seasonal allergies?
I have asthma.
Okay, and do you usually use your inhaler?
Yeah, sometimes. I mean, I don't know. I think it more gets flared up if I'm partying or something, but I don't take it all the time.
Okay, when was the last time you had to use your rescue inhaler for an asthma attack?
2 days ago.
Okay, and have you been hospitalized due to asthma within the past 6 months?
Well, I had bronchitis last year. It's probably been, maybe 6 months ago.
Okay, all right.
Mhm.
Okay. Now I see that you have a history of occasional reflux,
Mhm.
reflux, yes.
Yeah, but this hurts more than that.
Right,
I
yeah.
mean, okay.
Right, yeah, I understand.
Okay.
Do you take any kind of medication for that reflux? Any over-the-counter medicines?
Sometimes, yeah.
Okay.
Not all the time.
Have you taken any recently?
No.
Okay.
I don't have any money. You know?
That's a tough situation,
I
isn't it?
know.
Yeah. All right. Have you ever had any liver problems? Have you been diagnosed with hepatitis, cirrhosis, pancreatitis, or any abdominal issues?
No.
All right. What about any type of bladder or kidney issues? Have you ever had frequent urinary tract infections? Anything that you might be on any type of antibiotics for? Okay, great. Any type of blood issues? Have you ever had a blood clot? Felt pain in your calf muscles, soreness, swelling, anything like that? Ever been diagnosed with a deep vein thrombosis? All
No.
right. Okay.
I hope not.
Yeah, well, we don't want that either. Just sometimes with birth control pills and smoking, that increases your risk, and especially over
Oh
the age of
yeah, I've got
35.
the spill. Oh yeah.
You've heard that before.
Mhm.
All right. The next thing, have you ever had any type of bleeding disorder, anemia, any other type of blood issues that you're aware of? No leukemias, cancer?
Nope.
Okay. All right. What about the endocrine as far as your diabetes, thyroid? Have you ever been diagnosed or told you had any issues with either of those? Okay. All right. Have you ever been on long-term steroid use for any type of medication treatment?
I don't think
that you
so.
know of? Okay.
Mm-mm.
Pregnancies. I see that you have 2 children. Is that correct?
Yeah,
Okay.
I do.
All right. Is there any possibility that you could be pregnant now?
Maybe.
Okay.
I don't know.
Okay. Well, we're going to do a simple urine test just
Okay.
to make sure for that. We'll send that off, have the nurses collect that, so that we make sure that if you are indeed pregnant, then we can adjust appropriately.
Okay.
Have you ever had any type of surgeries related, gynecological surgeries, any type of ovarian cyst removed, anything along those lines? Okay.
Nope.
All right. As far as, there's another thing I saw on the chart that said a past history of STDs. Do you have any current issues with those right now?
No, I mean that was in the past. I'm clean. I'm clear.
Okay.
I'm good.
All right. And what type of STDs were those that you did have?
I don't know. They said something about Ghana something.
Gonorrhea?
Oh yeah, something like that.
Okay. All right.
Yes, but I'm good.
Okay. All right. We'll take care of that. All right. Now, you did mention that you drank alcohol occasionally earlier. Now, how much do you drink?
I mean, it depends. It depends on the specials. You know how it is. Like sometimes I want a Long Island.
Okay. Well, that's tonight before you had
Oh.
your accident. How much did you have to drink?
How much? I want to say it got a little hazy after 5. So,
And about what time did this start? Or did you have your first drink tonight?
tonight, 5 p.m. maybe.
Okay.
Yeah.
And you had your accident around 8. Okay. All right. Had 5 put in. Now, what about any type of either IV drug usage or any type of
Oh no,
drugs?
don't
Never had?
mix.
Okay. What about just regular type of drugs like pills, anything, hydrocodones, any type of ecstasy, anything like that? And
No.
if you are, this is completely confidential between me and you. Won't be your parole officer will not have any knowledge of this information. So.
Nope.
Okay. All right. It's just very important that we know any of this information just due to the treatment that we'll give you, so we don't need interactions or anything.
All right.
All right. The other things that we need to know about is any past surgeries that you've had. Have you ever been hospitalized with a surgery, or even something as minor as having tonsils that was removed as a child?
No, I'm pretty healthy.
Okay. All right. Have you ever had any type of anesthesia? Like whenever you had your children, did you have an epidural of any kind?
Yeah, I think I did.
Okay.
Nope. I mean, nothing went wrong.
Okay.
I
All right.
mean,
I'll look in your medical
Okay.
charts and see exactly what you did have
Alright.
since you delivered at this hospital. Your family, do you know if they had any risk of malignant hypothermia whenever they did have any type of surgery? Like, I know that your family history here said that your father has cardiac issues, your mother has hypertension and a stroke. If they've had any procedures, have they or developed increased temperature during or after their procedure that you're aware of?
No.
Okay, all right.
Uh-uh.
That's just something it's just a familial issue, so
Okay,
we just wanna
okay.
check on that.
Alright.
All right, I guess, gonna just ask you to do a few things. Those are basically the questions I need to go through. Now I'm gonna do an actual physical assessment, gonna check your mouth.
That's fine, but am I gonna get medicine?
Yeah, you're gonna get medicine, I promise. Okay, I'm gonna do a physical assessment of you before we take you back to the operating room. First question I have is about how tall are you, Cupcake?
About 5'1".
Okay, and about how much do you weigh?
175.
Okay, all right, from that we'll calculate your body mass index and we'll use that to base the amount of anesthetics that we'll give you, okay? So the first thing we're gonna do is we're gonna have you open your mouth really wide for me, please. Okay, all right, now look up for me. All right, and stick your tongue out with your mouth open. Look up again, please. Okay, all right. Now, I want you to move your head to the left and to the right. Okay, and put your chin down to your chest. Okay, and lift your head all the way back as far as you can, please. All right, and then come back down to the midline. Can you please extend your teeth out in front of your bottom teeth out in front of your top teeth? All right, stick your chin out. There you go. Just like that. All right. Now I want to look in your eyes, okay? Do a neurological assessment. Okay. And can you squeeze both hands for me, please? That works. All right. Can you press out with these feet? Uncross them. Press out. Okay. Pull in. Okay. Good deal. And how do you have any issues with your arms? Can you move them up and down? Okay, move your shoulder arm all the way up. Okay. Let's just watch that IV. Let's do the same thing with this other one. Okay. And you can move your legs around. Okay. Don't have any problems.
Yeah, I'm good.
You can, all right, well, I don't want you to be punched. The trauma scan didn't reveal any type of, bone injuries other than your chest, no broken ribs, so that's good. So now I'm gonna listen to your lungs real quick. Just take deep breaths in and out. In, out. Okay, we'll listen to your heart. Definitely hear a little bit of muffled sounds, which that's common with this type of injury. Okay, and we'll press your abdomen, see, okay, you don't have any issues there. And we'll feel your pulses. Can you hold your arms out for me, please? Take a deep breath in, out. Okay, we'll feel your central pulse, your carotid pulse, and out. Okay, there is a little bit of pulsus paradoxus, so that's also another way that we know how your blood pressure is in relation to this tamponade, because whenever you breathe in and out, then your pulse fluctuates due to the increased pressure around your heart.
Y'all speak a different language, don't you?
Do we? I know.
Yeah,
It's
kinda.
it's some different words. I know, it sure is. Whenever you were driving, whenever you had this accident, is that correct?
Mm-hmm.
Yes, and do you remember anything? They said that the steering wheel was actually caved in around you, so that means that your chest is what actually hit the steering wheel, so that's what causes trauma in there.
Yeah, I mean, it's fuzzy. It's fuzzy. Yeah.
With any kind of procedure, there's risks.
Risks.
There are risks with anything. The surgeon will talk to you about the actual surgical risk, and we'll talk to you about the anesthesia risk. As far as common complications that you'll have coming out, you may have a sore throat and the endotracheal tube, which is what is going to help you breathe during surgery. So your throat may be sore. Women typically get a little nauseous after surgery. You may have some vomiting. We'll pre-treat you with some Zofran, so that's going to help you with any type of nausea or vomiting. There is that risk of aspiration that we talked about because you have eaten recently. What we're going to do is called a rapid sequence induction whenever we do anesthetize you. So we will help maintain some pressure in your throat, and what that's going to do is prevent any of your stomach contents from possibly coming up and going into your airway. There's also a possibility of stroke, heart attack, and death with any of these procedures, even though this risk from general anesthesia is small. As we did talk about, we will be using a general anesthetic approach where you'll be completely anesthetized. You will have amnesia of this scenario is our goal. We will also provide you with analgesia, which is the pain control.
All right.
So there's your pain control.
Okay.
You will hope not remember the procedure, and
couldn't wait for that.
Yeah, that's what you wanted, I know it. So then we will wake you up after the procedure. Like I said, the surgeon will talk to you about how long it'll take and everything that's involved. And
They'll let me go smoke after, right? I mean, that's gonna
Well,
take care of the
it-
sore throat.
you think so?
Yeah.
Well, while you're on oxygen, you definitely won't be smoking any. You could blow up. So that's we don't want that. We don't want that at all. No. Okay. Well, I will be back in just a little bit if I need any more information. Okay.
Okay.
As long as you hear from the side, you're good. Are you playing good?
Hi,
Hi.
I am Dr. Feelgood.
Nice to meet you.
I'm one of the cardiac surgeons here.
Okay.
What's your name?
My name's Tori Smith.
Tori
I go by
Smith.
Cupcake.
You go by Cupcake. Okay.
Mhm.
What's your date of birth, Tori? I'm going to talk to you about what's going on here. You have something called cardiac tamponade. When the fluid around your heart is filling up and it's full of blood, it's because that steering wheel.
That's why it's killing.
Yeah. Okay. So what we're gonna do is before we take you back, we're gonna give you some fluids. Not like any liquor or beer or anything you've been drinking for tonight. We're gonna give you something else like volume expanders. They're gonna help, keep your blood pressure up because you are bleeding a little bit, okay?
Oh.
Yeah. We're gonna give you some other drugs that increase your heart rate, make you feel a little worked up,
Okay.
but it's all for the good of your blood pressure and keeping you stable, okay?
Okay.
We also are gonna correct some acidosis that you have with.
That's a what?
Yeah, acidosis.
Okay. All right.
Okay.
Okay.
So right now you look pretty stable. Most people when they come in here.
I mean, I might look it, but my chest is killing me. I've told everybody that.
All right, we'll work on getting you some payments.
All right.
Okay.
Okay.
We
I
have
know it's not your fault.
We have to tell you all of this before
I
you
know. I
pretty
know
much
that.
get anything because.
I know, Doc.
All right.
Okay.
We're gonna put some big IVs in you, probably in your neck or maybe over here by your collarbone. Okay.
I hope they're good at it.
They are very good at it.
Okay.
Okay. They're this way they can continuously monitor your blood pressure, continuously monitor all your vital signs and everything, and they can give you a lot of medications through those lines that you can't normally give through a regular IV.
Okay.
Okay. And this way we can draw our labs off of that, and you won't have to worry about getting stuck 1,000 times. How's that sound?
That's better.
Okay.
Okay.
The type of anesthesia, I already talked to the anesthesiologist and the CRNA about this. We're gonna probably do a local anesthetic for right now, because if we give you any of our good drugs, it might kind of tank out your blood pressure, okay? So we're gonna go in there, we're gonna, put it right in your chest, numb it all up. So, we'll numb up that, then we'll get the fluid out of there, and then, we'll switch you over to a general anesthesia, okay?
In order to do the window.
In order to relieve some of that fluid in there, we need to make an opening in your heart so that we can let the juices out. So the type of anesthesia we'll use is called ketamine and pancuronium. Both of those drugs that we use don't decrease your blood pressure as much as some of the other ones, okay?
Mm-hmm.
As I said earlier, we could give you a little thing that's going to make you a little feel, revved up. It's called epinephrine. Kind of like when you get nervous, you get really excited, some of that. But it keeps your blood pressure up and your heart rate up. So we'll use those so you don't tank out, okay? Okay, all right. We'll probably put a couple chest tubes in, maybe one here and one over here. That's normal. Things that can go wrong with this, we could lacerate your heart, we could puncture your lung, but hopefully we'll get it right. Okay, just there's a lot of major organs in that area, and if a lot of major blood vessels, so chances of nicking one are slim, but it's possible. Okay. We'll also get you some blood ordered because you might need a transfusion during the case. Okay, we'll draw some labs and try to figure out what blood type you are, unless you already know.
Man, I was not planning on all this.
I know. But you're just gonna get sicker if you don't deal with it now, okay? We're gonna have someone come in here and take a picture of your heart with some little leads on, some stickers. We're gonna take a chest X-ray. Then we will draw your labs, send them all off. We'll draw some clotting factors, make sure you're clotting effectively. And we will, send all your labs off, okay? And we'll do that pregnancy test as well,
Okay.
alright?
Mhm.
Do you have any questions for me?
I don't think so. Except I got some. I'm not working right now, so I got some papers for you to fill out.
Okay.
So do you think you could do that for me?
We can do one thing at a time. Right now, your priority is getting you, back in the operating room and getting this fixed up. Okay,
Alright.
I will handle those
Okay.
when you're done, okay?
Mhm.
You might go to the ICU, unless it looks okay, and we might take the tube out right then,
Okay.
okay?
Mhm.
Alright, is there anybody you need us to call?
No, my guy's on his way.
Cupcake, I'm gonna have some people come run some tests on you, and, let's get you back there, okay?
Okay.
Alrighty.
Okay, can we